So the movie Jaws forever ruined the beach for me. You cue the music from that movie and my heart instantly begins to race. I mean, it did a number on me. That's the soundtrack I hear whenever I get in the waves. It even got me scared of sharks in the swimming pool or even a bathtub. And thanks to the movie Sharknado, I now don't even have to be near water to be scared of sharks. Although I think even the most shark-phobic among us draw the line at sharks falling from the sky. So that's always been one big phobia of mine. Another lifelong phobia of mine is a fear of cancer. The mere mention of the big C had me instantly assuming the worst, and I equated it with a death sentence. So a few years ago, just before Mother's Day 2011, I came face to face with one of my worst fears. No, I was not stranded in shark-infested waters. The other one. I got a call from my doctor, that one many of you in this room have received, the one that starts with the words, "I don't know how to tell you this." Now, I'd gone to see my doctor because I had a recurring pain in my rectum, which anyone who knows me finds highly ironic because I've often been described as a pain in that very same area of the body. So I had this pain, and the first time I felt it was at the very beginning of 2011. And it was there for about 3 days, really unrelenting, but then it went away. And I'm the kind of person who, I don't think, no pun intended, I gotta get to the bottom of this. I just was like, okay, great, it's gone, on with my life. About 3 months later, it came back. And at that point, I could stand it no longer, and I called my OBGYN. I went in to see him, and he took an ultrasound and saw that one of my ovaries had twisted and descended and was rubbing against nerve endings on my rectum, thus causing my immense pain. But he wasn't the least bit concerned. In fact, the word cancer never came up. He told me that this happens for a variety of reasons. They call it torquing, the fancy medical term for twisting, and he said, this happens, he said, primarily due to excessive sex. So I asked him what was behind door number 2, because I told him that my husband would be astonished to learn that we were engaging in excessive sex. And just to really embarrass him, he's sitting right back there. And then he told me it could also be due to excessive exercise. And this actually made sense, because I'm someone who's not graced with the kind of metabolism that keeps up with the calories I consume, and so I try to kind of offset that by exercising like a banshee. So we both agreed that that must be it, and again, cancer was never mentioned. We scheduled outpatient surgery, laparoscopic, just to remove that one misbehaving ovary the very next day. And then off I went on a business trip to Philadelphia. And that's where I was when I got that call that began with the words, "I don't know how to tell you this." So I'd like to pause here to reflect on the fact that ovarian cancer is still so very difficult to detect. Here I was with an OBGYN who's trained to know that part of the body, who's gains expertise in those very organs, who held it in his hand. He wasn't looking at it through some fuzzy, images on some diagnostic tool. And still, the word cancer never came up. Luckily for me, anytime an organ is removed, pro forma, it's sent off to a pathologist, and that's where the word cancer came up. It was a pathologist who saw cancer and let my OBGYN know, who then let me know. And as many of you also know, that call served as the demarcation between life as I knew it and everything that followed. That call marked the ending of my pre-cancer life and started my new life filled with inexplicable things that happened in very quick succession, like hair loss and surgeries, and had me suddenly and just inexplicably wondering if every family milestone I enjoyed would be my last. I had to laugh when we're talking about the symptoms when I was a speaker at the Maryland chapter of the National Ovarian Cancer Coalition, because they had some of these symptoms and signs up on the route of the race that they had. And so every few feet you would see a little sign that said, are you bloated? Do you have diarrhea? Are you constipated? Are you fatigued? And I figured that pretty much every woman there either had ovarian cancer or left absolutely convinced that she had ovarian cancer, right? This is why it's so hard to diagnose, because it's so often misdiagnosed, not only by women, but by their doctors as other things, right? I've talked to women across the country who were first diagnosed with irritable bowel syndrome, or what I like to call GO. Does everybody know that disease? It's called getting old, right? And now when I go in and see my doctor and I kind of say, oh, like, look what chemo and cancer did to me. I can barely move my knee. And he says, Katya, that's not on me. That's on you. That's called you're 49 years old and you have arthritis in your knee. On the heels of my cancer diagnosis, I was also diagnosed with having the BRCA1 genetic mutation. The pathologist who had diagnosed cancer had seen markings that were consistent with BRCA1, and then this was confirmed by my hospital's geneticist. Now at the time, this seemed like the hits just kept on coming. It felt like a double whammy. I thought, not only do I have cancer, but I also have this mutation, which is kind of ironic in retrospect because cancer itself is a mutation. But it felt just like I was losing the lottery again and again. But I've changed my mind about that, which I'll discuss later in my talk. And I have to tell you that facing cancer, as I'm sure is true of so many of you here today, allowed me to conquer my fear of it. My fear was based on this antiquated view of cancer. I had envisioned these just bald, emaciated, weak people who lived out their remaining days bedridden and miserable. Okay, that is so not the case. Emaciated? Would you believe that I actually gained weight during my chemo? I actually ran races, I went ziplining, and even the bald part, once I embraced it, was actually great. It made for a really speedy morning routine, and it actually made for a great mouse costume. This is my girls and I in a community theater production, and I'm pretty sure I secured the role of mouse because it really, those ears just looked awesome atop a bald head. We actually had our holiday card that year. We had my entire family rubbing my bald head for good luck. That was our holiday card. And rocking the bald, as I came to call it, really epitomized my entire approach to my cancer journey. I really just felt like there's plenty of bad, which is for sure. There's no way to sugarcoat the things like chemo-induced nausea and the fear and discomfort of having something odious growing within your body and then having to combat it with something even more odious. The time suck that being a full-time patient entails, and the loss of dignity of having a body ravaged by drugs and surgery and illness. But, and it's a big but, there were plenty of high notes too. And sometimes you have to look a little harder to find them, but they really were there. And so that's what my talk is about, is I want to share with you some of those high notes and some of the unexpected moments of joy and levity that I experienced during my cancer journey. Now, everyone has a different way of processing their cancer. And for mine, as she mentioned in the intro, I'm a writer. So my way of coping and dealing with my cancer was to write about it. I wrote a series of emails that I sent out called Ovarian Odyssey, and I would send those out to friends and family near and far just to kind of update them on what was going on with me. I also write a weekly column for the Charlotte Observer, so I chronicled my cancer journey in the paper, and you can just, there's a bunch of them, so you can just go through them, and I profiled doctors and nurses who treated me, as well as fellow patients. And then when my cancer recurred, I mentioned new treatments that I was experiencing, etc. It was amazing to me how many people were unaware of various developments within the cancer world until they read my column. And I'm just a freelancer, so there's some disconnect there between getting the word out, as the doctor who preceded me was mentioning. Finally, I wrote a book about my cancer journey that I called But I Just Grew Out My Bangs, a Cancer Tale. And I intentionally picked this title because I wanted folks to know that this is not some sad, morose tale about my cancer journey. It was, in fact, to let folks know that there were these unexpected moments of joy and levity. So those are some that I'm going to recount for you now. When I was diagnosed, it was just before Mother's Day, 2011. And I have 3 kids. My son was in boarding school. He was at a public boarding school for math and science about 2.5 hours away from us. My middle daughter had just started high school, and then my youngest daughter was 11 at the time. And we decided to hold off on telling them that I had cancer until my 2 older ones had finished the school year, because we were just a few weeks shy of that, and it was high school and grades count, and we wanted them to just get through their exams without having that hanging over their heads. I don't know if I'm really up to this, but on the other hand, I should probably do it right when she wants to talk about it. So all of this is going through my mind, in addition to the fact that I feel like I'm just, miserable and incredibly nauseated. And then I say, sure, honey, what's up? And really just trying to buy myself some time. And at this point, the tears are flowing. And she says, Mommy, look. And she points to the very beginnings of a pimple. And at the time, I was extremely relieved that that's what she wanted to talk to me about. About the 4th time that she came to see me about this nascent pimple, I was ready to throttle her and tell her that that is not a problem. So about a week and a half later, my son comes home, my daughter has taken her last exam, and so we summon all 3 kids in for a family meeting to tell them that I have cancer. And much like I began tonight, I began that family meeting by talking about my well-known pathological fear of sharks. And then I segued from that into saying that no matter how many Discovery shows I've watched, I'm still deathly terrified of sharks. But in fact, my other fear, one of cancer, the more I've learned, the better I felt about it, because that was based on this antiquated view. And then I told them the reason that I've been learning more about cancer is that I, in fact, have cancer. So my youngest daughter, Eliza, the first funny that happened is at the end of the night when she kind of realized that I'd already had the surgery and kind of gone through all of this without them knowing, as we were kind of checking in with each of them about how they were doing, she says, "Man, Mom, you're a really good liar." So that was her takeaway. And then that night, I'm tucking her into bed, and I said, "How you doing?" And she said, "You know what, that sucked." And I said, "Yeah, and she goes, "No, I thought when you called the family meeting and you were talking about sharks, I thought that we were going to SeaWorld." And then when you kept talking, I'm like, "So we're not going to SeaWorld and Mom has cancer? This sucks." And in fact, a few weeks later, she kind of said, "So is there no SeaWorld?" And I said, "Sweetie, you brought SeaWorld to the table. There was no SeaWorld." But I'm happy to report that a year later, Eliza and I went to SeaWorld. So then the next thing that happened was, go ahead, sweetie. As soon as I found out that I had cancer, I knew that I wanted to cut my hair and donate it, because I wanted to have, and I think many people share this, you want to just kind of take control and say, "Thanks, I get that I'm losing my hair, but I'll decide when, thank you very much, and I'd like something positive to come of it." So I decided to go to a swanky salon to have my hair cut. The picture before, which we didn't dwell on, I just want to, yeah, every woman will recognize that I had, in fact, just grown out my bangs. So that was the one difficult part for me. But we went to this swanky salon, the kind that I would never be able to afford if I were really getting my hair cut. But it turns out that when you're getting all of your hair cut, it's free. And so I decided to take my daughters there for a pedicure and just make it kind of this fun, festive experience. But I could tell that obviously, watching your mom become bald and all that it implies was really difficult for them. And so this proved to be the first of many, many moments of being able to reassure them and myself that the core of me remained intact, that there was lots going on around me and to me and with me, but I was still the mom that they knew and loved. So here I am in the salon, I'm getting it cut. There I am holding my ponytail, and the woman who came in after me, who was this very well-coiffed, very wealthy woman who was coming to get her hair done up, I just couldn't resist, and so I just whispered to her as she's kind of looking at me in consternation with my bald head, and she says, and as she's being whisked away by the same hairdresser who had just shaved me, I said, "Watch out, all I asked for was a little trim." So So she just had this look of horror, and my girls were cracking up, and it was really just a way of saying, guess what? You know, I'm still the mom you know. Yeah. So, and then I gotta say, even chemo had its funny moments, right? So and trust me, there was plenty that was not fun about chemo, but I had Taxol and cisplatin, and I had it through a peritoneal port in my abdomen, which meant that on what they called my short days, which made me think that doctors are really bright and talented, but they're not good at math, because my short days were just like 2 hours shy of my long days, right? But on one day I would be in a private room, flat on my back, because that's where it was administered through my port. But then I would go in on other days to get what my nurse practitioner called my happy meal, which was, you know, the drugs and fluids and things that would help me kind of deal with the chemo. So I pretty much lived at the hospital, because that would be the 3 or 4 days after each long or short day. But on those days it would be a little bit more social, because I'd be in the main chemo room, in the infusion room, and I'd be sitting you know, next to folks, and some of them wanted to chat, some didn't. And I was next to a man who didn't want to chat and was clearly just kind of keeping to himself. And I got up to go to the bathroom. Now, when I was in the private room, I would take my little IV pole with me, and it had 2 plugs, and I would undo them and make my way to the bathroom. So I'm sitting next to him. I unplug what I think is my IV pole, and I'm heading to the bathroom. And as I'm walking there, luckily, slowly, because I'm somewhat inhibited by the IV pole and my state, but as I'm walking, I see him leaning out of his chair like this. And I turned to him and I said, am I taking you to the bathroom with me? And he said, it appears so. So needless to say, I went back, plugged him back in, and we became fast friends after that. Another funny that happened during chemo was that I would get Ativan to relax me when they were trying to put this needle into my port, which for those of you who haven't had a port, it turns out it's just this, you know, untethered, very small mesh kind of free-floating thing. So it's really a difficult thing to get this huge nail not only through your skin, but into the little opening there, especially when it's moving around. It usually was very traumatic for my nurses and my friends who happened to be there. Luckily for me, there was no trauma, because the Ativan also had this amnesiac effect. So I would go in the next day, and invariably a nurse would reach out to me and say, do you hate me? I'm so sorry that it took 3 of us to hold you down. I have no idea what you're talking about. But my friends would fight for having that shift on my chemo schedule, because that was when I was at my most entertaining. The Ativan apparently unleashed all sorts of things. So you can tell I'm pretty freeform anyway, and with Ativan, forget about it, right? So one of the things that my Ativan-induced kind of delirium produced was that I was absolutely convinced that my longtime crush, Colin Firth, was going to be coming to join me. And I would kind of let everybody know. And my husband, whom I adore, and if you read my book, it really is like a love story to him, but he knows if Colin Firth comes to Colin, I'm sorry, but I'm out of here, you know? In any event, so this was this well-known crush that I had. And so my son, I mentioned he's at this boarding school in Durham. Well, lo and behold, in the middle of my chemo, he calls me up and he's like, Mom, you are not going to believe this. Colin Firth is filming a movie at my school. So I said to him, well, you've got to get your picture taken with him. And he said, Mom, he's going to be mobbed. There's no way. I'm like, Noah, this is what the cancer card is invented for, right? I'm just like, if ever you get to play the cancer card, this is it. It's for Colin Firth. So sure enough, it turns out that movie was with Emily Blunt, and everyone in his boarding school was mobbing Emily Blunt. So he actually got to make his way over to Colin Firth, and he somewhat botched the message. I said to him, just tell him your mom has cancer, right? And in fact, what he said to him, and you'll see if you look closely at Colin's, there's my son, and there's Colin Firth, and what my son in fact said to him was, you are all my mom thinks about during chemo, which is just a slightly different message, right? And if you look closely at his t-shirt, now those around me, you know, I wasn't the only one finding the funny. Those around me responded with humor as well. My friend, when we all ran in a race together, go ahead, honey. They made these T-shirts for us. This is what was on the back. Just some of my, you know how I told you I sent out these ovarian odysseys. So these were things that they'd culled from some of my emails, but we all ran with those race shirts. And my nurse practitioner, in fact, next one, actually made me a prescription for running the race. She actually, I thought, had a very unrealistic goal time, but in any event, that was my and my sister sent these Cancer Sucks water bottles for all of us to have. I have to pause here to talk about my sister. She actually outdid herself with her creative, humorous gifts to me. But I have to tell you that she also just completely had this wonderful sense, and every one of us needs someone like this in our lives, of like knowing when I wasn't finding the funny, right? And then she wasn't going to force it, because I always tell people, we get to decide when it's funny, right? Not you. We had a doctor once when my cancer came back, and we went in for my splenectomy, and we're terrified that it's come back, and we're just totally dismayed, and he walks in and he says to the two of us, so which one of you is getting your spleen out? No, that actually wasn't that funny, right? Because we get to decide when it's funny. But my sister, next one, please. One of the times when I was just feeling so low, she sent me this: just because you had a bad day doesn't mean you're not strong. You don't have to be strong every minute of every day to be strong. You don't have to prove that you're strong. You don't even have to be strong. Sometimes it's overrated. And that was like on a day where I was feeling like I was letting everybody down, that I couldn't be the like, yay, it's all good, I can find the funny cancer patient. I really just was like, this stinks and I'm miserable. And it was just so helpful that she met me where I was. But most of the time, she sent the most fabulously creative and funny gifts. So for instance, when I developed a metallic taste in my mouth, which was a serious, serious bummer, because I'm a foodie. And so when that happened, I was like, oh, you can do all sorts of things to me, but don't get between me and my food. So she sent me a Metallica gift box. It had really practical items like a tongue scraper and butterscotch candies and breath mints, but it had on the cover this Metallica. And then the best thing that she did for me, and I have these in the back to give as bookmarks with the books, is she made these cancer cards for me. So they say things like, I have cancer, you do not. In the future, please keep in mind that I have cancer. Please do this. Why? Because I have cancer, that's why. And I know it's not your policy, but please make an exception. I have cancer. So, needless to say, I rarely played them, actually, when you talk about playing the cancer card, but it was just so fun to have them and to just kind of like, I mainly gave them to fellow patients to just get a smile out of them. Now, sometimes the humor in my cancer journey can be kind of somewhat dark or inadvertent, like when you use it as a way of expressing the things that bother you. So here were a couple of my pet peeves and my push-button issues. David was fabulous. I'll just say that right off the bat. But sometimes when people asked me how he was doing, and I totally get that the caretaker role is really difficult as well, but sometimes that really rubbed me the wrong way. So one time, my mother-in-law called, and I was just feeling so jealous of his ability to take the kids to Fuddruckers, and his ability to poop when he wanted to, and his ability to eat what he wanted, and to sleep through the night, and to not have clothes that no longer fit him because he was so bloated from chemo. I was just so envious of just his ability to basically live his life. And she called, and I get it's her son, right? But she says, how's David? And I just was ready to throttle her, but I kept it in, and I decided to go for a walk. Now, I'm a walker. I walk for miles every day. But at this point, I'm barely making it around the neighborhood, which is depressing enough, right? And I'm convinced that like that part of my body is just never going to be healed. And I'm just really frustrated that I'm just shuffling along, and a neighbor comes out full of concern and pity. And I can tell that she's going to say, should you really be walking? And I'm going to tell her, actually, the doctors told me it's good for me, and it's okay. And she comes up and takes my arm, and what does she say? How's David? And so on the heels of the call with my mother-in-law, what I say to her, and this was the beginning of my campaign of alienating neighbors left and right, was I said, well, David did not have his vagina sliced open, so he's A-okay. Another time, another just total push-button issue of mine was when people would ask me what my prognosis was. And, I sense that you all are right there with me. My view is, you either know me well enough to know what it is, or don't ask, right? And I'll add a new layer to that. Don't ask in front of my kids. My youngest child, who was 11 at the time, told me that she never, ever considered the possibility of my dying or feared anything like that until people started asking what my prognosis was. So she had actually just confessed that to me, and we were out on a walk, and another neighbor came out and kind of, did the whole, what can we make for you, etc. But then she said, if you don't mind my asking, what's your prognosis? And I saw my daughter tense up next to me, and so I just held her hand, I looked at the neighbor, and I said, well, I've only got a week, but I'm just trying to make the most out of it. And she just kind of looked like this. My daughter was like, yeah, and off we went. Pretty sure that neighbor's never going to ask someone again what their prognosis is. And then there were just comical moments that came from people saying the most ridiculously inappropriate things. And sometimes laughter was just a more, probably socially acceptable way to handle it than throttling them, right? So one time I'm in a Panera Bread. I don't know if you all have those around here, okay? And I had just dragged myself there to work. I was writing my column. It was hard enough for me just to even be out, but I just figured, you know what, I could be in bed, or I could be out. Sometimes that was all it took to just kind of get me going, but I'm just trying to work, and the woman who busses and cleans up the tables comes by and she goes, what kind you got? So I said, I'm sorry, excuse me? And she said, what kind you got? I'm sorry, I don't understand. What kind of cancer? What kind you got? Because I was, bald at the time. So I said, ovarian. Oh, that is so cool. That's exactly what the woman who always sat there had. Yep, she had ovarian cancer. So I said, so how's she doing? Really more just to keep up my end of this decidedly awkward conversation, right? And what does she say? Oh, yeah. Oh, she died. Yep, she didn't make it. But that's exactly where she would sit. And I'm just looking at her like, on what planet was that a helpful thing to share with me? Another time, we went to, the context for this story is that I did find out, that I was BRCA1 positive, and so that meant that I had actually an 85% chance of getting breast cancer. And I just decided those were not good odds. I had already lost the cancer lottery. I didn't want that fear and worry. And so I elected to have a double mastectomy. And we went to what's called a breast cancer reconstruction symposium, which these are one of the many, many things that, like, who knew, right? Who knew that there are chemo navigators in this world? Who knew that, you have to make these sorts of decisions? So apparently there's an array of ways that your breast can be lopped off and reconstructed. And so we went to learn about them. And while we were there, I was in the middle of chemo. Again, I'm just wishing I could be flat on my back in bed, but this was the night that it was, and we're feeling miserable. And they had a guest speaker who was a woman who had had this very same surgery that I ended up electing to have, which is called a DEEP, when they take the fat from your stomach to make your new breasts. And again, when you're struggling to find your silver linings, I got a free tummy tuck. So she's talking about it, and she said that the one main thing she learned is not to judge people. That pre-cancer, she might have judged people who maybe were out in their pajamas, or who were having a bad hair day, and now she knows that there's all sorts of reasons that these kinds of things might happen, and that she's really learned, particularly when it comes to someone's physical appearance, not to say anything disparaging or think anything like that. So lo and behold, we leave early because I just can no longer kind of take it anymore, and my daughter was doing homework out in the lobby. We needed to get her home. And so while we're gathering our things, this woman comes running out after me. Now mind you, I am rocking the bald, okay? I never once wore a wig or a scarf or anything, and I just was like, everyone told me I had a beautiful head. I went with it, and I had no qualms. So this woman comes running out, and she says to me wait, are you leaving? Please, let me give you this hat, because your head's so big, it's the only one it'll fit. And I'm just looking at her like, did you not just have a whole talk about not to say things like that? So of course now I'm like, were all my friends lying to me? Do I have an enormously big head? And so sometimes humor is just like a great way, as I said when I was in the hairdresser at the very beginning of my journey, to reassure yourself and those around you that the core of you remains intact. So it was endearing to me and really made me proud as a parent when my kids were able to kind of start responding with humor as well. When I was done with chemo, which I finished at the end of October in 2011, some of my friends decorated a statue on the way to the hospital with balloons and the t-shirts and Katya's last one. And then shortly thereafter, I ended up having my double mastectomy. So I finished chemo the end of October. December 15th was my deep surgery, which was a 14-hour surgery. It involved 3 teams of surgeons. I missed breakfast, lunch, and dinner, which I've mentioned I'm a foodie. There's no way short of being unconscious that I'm missing 3 meals in a row. This is me on my way to getting my, my double mastectomy. And in one of those just kind of bizarre new normals that you find yourself in once you have cancer, one of the things we had to decide was about nipples. Who knew? But apparently you can have them surgically applied. You can have 3D tattoos of nipples. And so what you've probably gathered about our family is that we decided this was a family discussion. So we were talking about it at the dinner table, and my daughter, Hannah, decided that this is actually what I should have tattooed on my breast. And she was not the only one who kind of came through with just great cancerisms. My son, one day I was just feeling really physically discouraged. I just, didn't even recognize my body. And he just came up to me, and he is, I gotta tell you, the sweetest son you could possibly ask for. And he said, "Mom, just remember the 3 Bs. He said, "Mom, bald, bloated, and boobless. You are still beautiful." And in fact, when he went away to school, I said to my husband, "You do realize that you got to step it up now, because Noah's been totally covering for you in the whole making mom feel beautiful department." And then there were just funnies that happened along the way with some of the just ridiculous bureaucracy that is the medical community, right? So for instance, I got a reminder about my annual mammogram after my mastectomy. I was very curious to see how they were planning to do that. I also, not initially found this funny, but in retrospect, I thought it was funny that I got a $96,000 bill for that mastectomy. And when I called the insurance company, because of course it had been pre-approved, so I was a little confused as to why I was being billed, the female clerk explained to me, well, that was coded as cosmetic surgery. So I asked her, who chooses to do that, really? So yeah, you got to grab your moments of mirth where you can. I have to say, I'm not done with the journey. I had a recurrence this past November, but even before that, I really felt like once you're on this cancer journey, you're kind of always on it. I know there are folks here who are sometimes even decades past their initial, and you always have now this part of you that is a cancer survivor, right? I have felt betrayed by my body, but then I have felt swells of gratitude to that very same body for just taking all this on and bouncing back and seeing me through this. I feel like I have been tested and forever changed by how I responded to that test and how those around me did as well. It's not something I would ever wish to happen. So as much as good has come out of this, in fact, I always had this kind of inner stand-up comic wannabe, and now cancer has provided me with a platform for doing that. My girls came with me to a talk in Orlando, Florida this summer, and we actually sat at the dinner table and toasted cancer. Like, yay, mommy's cancer, look where we are. But no, obviously, I would never choose to have it happen. I'm finding the good in it, but no one would choose this. I'm reminded of the Gilda Radner quote that having cancer gave me membership in an elite club I'd rather not belong to. And I think, as everyone in this room knows, there's kind of the overall cancer club, and then there's the ovarian cancer club, right? In fact, I was speaking with, I think it was Nancy, earlier today, and she said that when she went to get teal to make things for today's talk, the woman at the store was like, oh, well, here's pink, that's cancer, right? I mean, folks just do not get it, and we get lumped in with them, and it just gets a little bit old how much attention and money and political pressure is directed to other, more popular cancers. So along those lines, I had my girls, I wrote a song for them about ovarian cancer that we debuted at the National Ovarian Cancer Coalition's annual conference in March. And it became somewhat of a little bit of a YouTube sensation, not cats playing the piano YouTube sensation, but nonetheless, for ovarian cancer, lots of hits. So I'm going to have them sing it for you now.
Every store is festooned with pink balloons. Pink ribbons are everywhere. With Race for the Cure, one thing's for sure. It's time for boobs to share. Pink is hot, but it's not symbolic of all that's there. So here's the deal. It's time for teal to make the nation aware. Ovarian cancer sucks. Ovarian cancer kills. Let's line up all our ducks and fill our research tills so that our docs so clever can banish it forever. Taxolence is platin, what a pair. Putting poison in but losing your hair. The hysterectomy just adds to the deal, all stemming from the cancer that is teal. Ovarian cancer sucks. Ovarian cancer kills. Let's line up all our ducks and fill our research tills so that our docs so clever can banish it forever. It's time for teal to steal some of the nation's attention. That's how we really feel. And so we'd like to mention this silent killer shouldn't be silent any longer. By voicing it, you see, we can become stronger. Ovarian cancer sucks. Ovarian cancer kills. Let's line up all our ducks and fill our research tills so that our docs so clever can banish it forever. So that our docs so clever can banish it forever.
So initially I saw this genetic mutation that I had as just the double whammy. And I have to say that I've really come around since then. First of all, I found out that, the doctor who preceded me in this room talked a little bit about this, but I found out that actually once you have the cancer, it was actually a positive for me to be BRCA1 positive, because my cancer was more receptive to the chemo because of that. I have some slides and some things explaining it, but really all you need to know is that I responded better. In fact, you do better with a port when you have that. And I actually see it not as a burden, but as a gift that I'm giving my girls, and I'll explain that to you. You know, I feel like the only way that it's a negative and something really scary and bad is if you ignore it and you let it take power over you rather than harnessing that power to your advantage. It kind of reminds me of my nurse once told me that she has some patients who come in to see her and stand backwards on the scale because they don't want to know the number. Now trust me, the scale is never a friendly part of my doctor's visit either. But I kind of feel like, how does that change the fact that the weight is the weight, right? Your pants aren't going to fit any better just because you didn't see what the number was. And similarly, I feel that way about a genetic mutation. I feel like it's there, it is what it is, but knowing it, we can turn it into something that can help inform for my girls, and my daughter just turned 18, and she can find out now, and she can decide whether to have prophylactic surgeries, she can decide on the timing of her pregnancies, and she can use that information as a tool to not only live her life and change her life, but quite possibly save her life. And so I really do see that as a positive. So this summer, I was asked to speak at the annual conference for Myriad, which is this genetics company that was the one who, in fact, diagnosed my BRCA mutation. They had seen me in Las Vegas, and they asked me to come, and they said, and we want you to bring the PowerPoint of the girls singing. And so, of course, it was July and in Orlando, and so I said to them, you know, they could sing it live. And so that is, in fact, what they did. And so when they were flying the three of us out, I thought, well, I better add another song now that they're flying my girls out too. So we wrote a song about genetic mutations.
My eyes are blue, and mine are too. Both our parents have blue eyes, so it comes as no surprise. What we learned in class is true. Blue plus blue makes blue. It's genetics 101, the recessive gene has one. Otherwise our mom would have some splaining to do. Genetics, what's not to like? Lets you know what's coming down the pipe. Some things are a certainty. Other things are a mystery. Find out what lies in store for you. Then decide what you wanna do. More tests or treatment or nothing at all. Now or later, that's your call. No need to worry, fear or cower, 'cause it's never too late to change your fate, and knowledge is power. It is so unfair that she got the red hair that was handed down from our great-grandpa Ben. And it's not right that she got dad's height, and both these genes will repeat again. There's one more that might lay in store. It's hidden deep within our core. It's something we would want to know, 'cause we sure don't want to let it grow. Our mom fought cancer and she won, but she tested positive for BRCA1. That means we could have it too. The good news is there's lots we can do. Genetics, what's not to like? Lets you know what's coming down the pike. Some things are a certainty. Other things are a mystery. Find out what lies in store for you. Then decide what you wanna do. More tests or treatment or nothing at all. Now or later, that's your call. No need to worry, fear or cower, 'cause it's never too late to change your fate, and knowledge is power. Now that I have reached 18, she can find out if she carries the gene. We hope we don't, but either way, what we find out will help us say what plans to make. The timing of things will still have all the joys life brings. It's better to know and do what we can, 'cause a long, full life is what we have planned. Genetics, what's not to like? Lets you know what's coming down the pike. Some things are a certainty. Other things are a mystery. Find out what lies in store for you. Then decide what you wanna do. More tests or treatment or nothing at all. Now or later, that's your call. No need to worry, fear or cower, 'cause it's never too late to change your fate, and knowledge is power.
I just want you to know that my slideshow ends with a shot my husband took of me last night in front of a fountain with teal water coming out of it, right here in St. Louis. And, you know, I think it's terrific that you all, you know, that you got your city to show support like this. You all just have to go out there, keep fighting the fight. Keep supporting each other, keep finding the funnies and the humor, and when you don't feel like fighting, get others to get in the ring with you and help you fight. But let's all just show the big C who's boss, and thank you so much for having me.